Let's practice NCLEX questions.
A client in severe respiratory distress is admitted to the hospital. When the nurse is assessing the client, what should the nurse do? A. Obtain a brief health history. B. Conduct a comprehensive physical examination. C. Delay assessment until the client's respiratory distress is resolved. D. Complete a focused assessment of the respiratory system. Answer. D. Rationale. During an episode of acute respiratory distress, it is important that the nurse focus the assessment on the client's respiratory system and distress to quickly address the client's problem. Conducting a complete health history and a comprehensive physical examination can be deferred until the client's condition is stabilized. It is not appropriate to delay all assessments until the respiratory distress is resolved because the nurse must have data to guide treatment. A client has had a total hip replacement. When assessing the client, the nurse understands that which sign most likely indicates that the hip has dislocated. A. Abduction of the affected leg. B. Loosening of the prosthesis. C. External rotation of the affected leg. D. Shortening of the affected leg. Answer. D. Rationale. The most likely indication of a dislocated hip is a shortening of the affected leg. Other indications of dislocation include increasing pain, loss of function to the extremity, and deformity. Abduction of the leg after total hip replacement is a desirable position to prevent dislocation. Loosening of the prosthesis does not necessarily indicate that the hip has dislocated. External rotation of the hip can occur without the hip being dislocated. However, a neutral position of rotation is the desired position. A client with schizophrenia is withdrawn and suspicious of others and projects blame. The client's behavior reflects problems in which stage of development as identified by Erickson. A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Initiative versus guilt. D. Intimacy versus isolation. Answer. A. Rationale. The client who is withdrawn and suspicious and projects blame is exhibiting problems in trust versus mistrust. Shame and doubt would be reflected as low self-esteem and suspiciousness. Guilt would be reflected in self-blame for all problems. Isolation would be reflected in a lack of long-term relationships. The nurse is assessing a client who has just experienced a crisis. The nurse should first assess the client for which behavior. A. Capability of effective problem solving. B. Increased level of anxiety. C. Shortened attention span. D. Seeks help from others. Answer. B. Rationale. During the first phase of a crisis, the client exhibits elevated levels of anxiety. If the client is able to use problem-solving capabilities, there is no crisis. A shortened attention span is a characteristic of the fourth phase of the crisis. Reaching out to others for help is indicative of the third phase of a crisis. A client with a new ileal conduit asks the nurse when to wear the appliance. What should the nurse tell the client? A. You need to wear your appliance all the time. B. You should wear your appliance after you irrigate. C. It's only necessary to wear your appliance at night. D. The appliance must be worn after your meals. Answer. A. Rationale. An ileal conduit is a urinary diversion that requires the client to wear an appliance, or pouch, at all times, not just at night, because urine drains continuously. I. Ileal conduits are not irrigated. The urinary drainage is affected by fluid intake, not meals.
Thank you. Visit my channel for more NCLEX practice questions.